Martin Luther King Jr. Day. In conjunction with AmeriCorps, we're Crisis Text Line, and we're here on this MLK National Day of Service. United we serve for youth mental health. My name is Dr. Shairi Turner, and I'm the Chief Medical Officer at Crisis Text Line. I'm an internist and pediatrician with expertise in trauma and mental health. I'm also the proud mother of 2 teenagers. Today, we will be discussing the critically important topic of youth mental health as the U.S. Surgeon General, Dr. Vivek Murthy, recently released an advisory entitled Protecting Youth Mental Health. We are so honored to have Dr. Murthy join us today, as well as our young social entrepreneur and innovator, Charlie Lucas, who's the founder of the NotOKApp. They are both here to engage with us in this important discussion. So I am humbled to introduce our U.S. Surgeon General, Dr. Vivek H. Murthy. His biography, as you can imagine, is lengthy and most impressive. But what strikes me is that he's been asked to be the nation's top doctor not once, but twice. Currently, he serves as the 21st U.S. Surgeon General under President Biden, and previously he was the 19th U.S. Surgeon General under President Barack Obama. He is a renowned physician, researcher, research scientist, entrepreneur, best-selling author. Dr. Murthy is among the most trusted voices in America on matters of public health. He lives in Washington, D.C. with his wife, Dr. Alice Chen, and their 2 children. As the nation's top doctor, the Surgeon General's mission is to restore trust by relying on the best scientific information available and providing clear, consistent guidance and resources for the public, ensuring that we reach our most vulnerable communities. To me, that means he is the eyes and ears on the health of our nation. During his tenure, he has drawn the nation's attention to our most pressing needs: Ebola and Zika viruses, the opioid crisis, the threat of stress and loneliness. He issued the first Surgeon General's report on alcohol, drugs, and health to recognize addiction really for what it is, a chronic illness, and not a character or behavior flaw. In this, his most recent advisory, he is asking us to pause as a nation and draw our attention to our children and their mental health and well-being. Our children are living through unprecedented times: the isolation and fear of the pandemic, racial unrest, and political strife and polarity, all set on this stage of social media. To their developing brains, this is just too much. Dr. Murthy, it is an honor to welcome you here today. Would you please share a few words with us on this topic?
Well, thank you so much for that incredibly kind introduction. You are making me blush there a little bit. Thank you for the kindness. And I should just tell everyone just how grateful I am to be here. I was mentioning to Dr. Turner and some of the team members before that I've known about Crisis Text Line for a long time. I've had a chance to interact with some of the leadership and staff before, and even to visit your office some years ago before I was Surgeon General. So I've been a fan for a long, long time, and it means a lot to me to be able to join you here today. So thank you, Dr. Turner, for this opportunity. And I'm so glad to also be here with Charlie, whose work is really inspiring, and I'm really excited to hear more from him on the panel that follows. Before we get into the panel, I just want to say to everyone that the reason I'm so grateful to all of you is because for those of you who are staff, who are volunteers, who are supporters of Crisis Text Line, you've played a really important role in our country's healing, not just during this pandemic, but long before then. Your service is involved listening to young people, caring for them, supporting them, not judging them, in their moments of need, but showing up sometimes for people who don't have anyone else to show up for them. And I think it's so appropriate that we're talking about that service today, because one of my favorite places in Washington, D.C. is the Martin Luther King Memorial. If any of you have not been there before, it's really one of the most beautiful places in DC and the most inspiring as well. And they have near the memorial, actually, a number of quotes from Martin Luther King engraved on the wall near the statue, the carving that they have. It's the centerpiece of his memorial. And the favorite quote of his that I, for years and years, wrote down and had sort of printed and stuck, in on my bookshelf and in nooks and crannies in my apartment, so I would see it and be reminded, is this quote. It's the one that says, "Life's most persistent and urgent question is, what are you doing for others?" What an appropriate question to ask ourselves on this day, on MLK Day, and on all days. And it's really a question that many of you are answering each and every day in the work that you do. But I think as a country, it's so important for us to grapple with that question now more than ever, because we're facing an incredibly difficult moment in our country's history, and I would say in the world's history. One that is sort of the tip of that spear is really the pandemic, but it goes beyond the pandemic. We have an entire generation of young people who are facing unprecedented challenges, from COVID to sort of the cultural forces around them that are undermining their self-worth, and also the challenges that people see around them, the existential challenges to our future, whether it be climate change, the threat of systemic and institutional racism, whether it's the violence that people see in their streets and neighborhoods and read about in the papers. All of this together undercuts the sense of hope and possibility that people have, that there is, in fact, a better future ahead. I believe there is a better future ahead, but I don't think it will come easy. I think we have to work for it. I think we have to enable people to believe in that. And that's something that each of you in your roles supporting young people are helping make possible. So as I close, I just want to make one last thing possible, sort of clear to you, which is that it's extraordinary as the work that you are doing is. I want you to know that you are not alone. There are people inside this administration around the country who support you, who see what you're doing, who value it deeply. One of the reasons I issued a Surgeon General's advisory on youth mental health that Dr. Turner mentioned was because I saw what so many of you have been seeing for years, which is that young people across our country are struggling, not in small numbers, but in large numbers that have the potential to impact, not only their lives, but the lives of people around them, their families, their communities in profound, profound ways. We have to respond to this moment with action that is as great and as significant as the scope of the crisis we are facing. And that's what I laid out in the advisory, were the pathways that we could take to doing that. But none of that is as important, really, as the commitment and the hard work that people on the ground are doing, and that is squarely all of you. So you have my deep gratitude. You are certainly answering Dr. King's question in such a poignant and powerful way in the work you do each day at Crisis Text Line. So I so appreciate you, and we'll look forward to the conversation we're going to have. Dr. Turner, back to you.
Thank you, Dr. Murthy, for always bringing us back to those timeless words of Dr. Martin Luther King. They're ever relevant to almost any situation, and this one in particular. So we are excited to begin this dialogue. But first, I want to introduce everyone to Charlie Lucas, who I fully expect to continue to change the world as well. At the young age of 13, Charlie recognized a health need for his sister, and to that end created a solution for the nation. So that is the epitome of public health. So Charlie, could you share your story with us as well, please?
Hi guys, I'm Charlie Lucas. I'm a 17-year-old app developer and the co-creator of the NotOKApp. So the NotOKApp app, it's basically just a digital panic button that when pressed, it sends a text message to your pre-selected up to 5 trusted contacts with a message that says, "Hey, I'm not okay. Come call me, text me, or come check up on me," along with the user's current GPS location and directions. And we currently have over 140,000 downloads internationally because we recently just launched in Canada and the UK.
Charlie, that is incredible. I always forget he's just 17, not just 17, but just an incredible mind and an incredible heart and spirit for this work. So before we get started, I want to acknowledge.
Turner, can I just say, when I was 17 years old, I think I was just wandering around in the proverbial wilderness trying to make sense of what was up or down. I just, kudos to you, Charlie, hats off. I mean, what an incredible initiative you've taken. I just want to say thank you for inspiring me and so many others.
Thank you. That means so much, especially coming from you. Thank you so much.
So I wanted to take a moment, and Dr. Murthy, you had alluded to all the people who are part of the crisis text line community. So I wanted to have an opportunity to acknowledge, and if you can shout out in chat, if you are joining us today and you're a volunteer crisis counselor or someone who's interested in applying to be a crisis counselor, if you're one of our college campus advocates, put your name in the chat. Or if you're one of our social work practicum students, all of these folks continue to help bolster this community of volunteers and those who are out there getting the word out about crisis text line so that we can help even more people in pain. So for those of you, and we're going to watch the chat, just let us know who you are. For those of you who are new here today, we are Crisis Text Line. We are a 24/7 free, high quality and confidential text-based mental health and crisis intervention support service. We serve texters who are younger than the age of 13 all the way to the greater than the age of 65. So basically we serve almost everyone in need. As we said, we've trained over 45,000 volunteer crisis counselors. We serve texters in both English and Spanish, as we are bilingual and bicultural, and we can be reached by text by texting empathy to 741-741. So I'm really excited to engage with both Dr. Murthy and Charlie as they bring their incredible expertise and personal experience to this youth mental health crisis conversation. So I'm going to start. We know that even before March 2020, mental health challenges were the top contributor to poor life outcomes for our youth. Based on a study from University of Michigan, 1 in 6 young people will experience a mental health condition at any given time. And as you can imagine, there's a disproportionate impact on our youth of color and our LGBTQ youth. So, Dr. Murthy, as we stated, you recently released this advisory, Protecting Youth Mental Health. Can you share with us and our audience some of the top takeaways that you really believe are important for people to know?
Well, thank you, Dr. Turner. I appreciate that. You know, the reason I'll just say that we issued this advisory on youth mental health in December of last year is because we really felt that youth are in crisis. And it's not just COVID, but as many of you may know, this has been a challenge for the decade preceding the pandemic as well. In the 10 years prior to the pandemic, there was a 44% increase in the percentage of young people in high school who said that they felt persistent feelings of sadness or hopelessness. There was a 57% increase in the suicide rate. The numbers, however you slice them, in terms of the data, tell the same story, which is that our youth are having a tough time and they're not getting the help they need. And so we have to, as a country, do more. Like we can't just ask organizations like Crisis Text Line to take on that entire challenge on their own, as extraordinary as the work you're doing is. This is a big enough problem that it requires a whole country to come together and to ask themselves, what can we do to be of service to youth in a moment like this? And so what we laid out in the advisory were actually a series of concrete steps that various parts of society could take. We had clear roles that government could take. We had a clear role that we were asking the healthcare establishment to take in terms of expanding access to mental health care services, which is still very difficult for many people. We knew that schools could play a really important role, not just by having more counselors present and on hand, but also by investing more upstream in social and emotional learning programs, giving young people a foundation for sort of emotional well-being from their early, and for healthy relationships in the earliest stages of their life, and without just assuming that everybody gets that at home, because it's just not the reality. So like this, we laid out a number of roles, and there was a role for technology companies as well. And we'll perhaps talk about this a bit later, but one of the things I laid out in the advisory is that we have in some ways been conducting a grand national experiment on young people when it comes to social media and technology. And we haven't understood fully the impact on their mental health. It's not to say that technology is all bad. In fact, there's a lot of positive uses of technology. I think Crisis Text Line actually has demonstrated that in your own work. But the question is, how do we be clear about how technology helps us and about when it actually can harm young people? How do we focus the use of technology more on the helpful uses? And how do we create the incentives for more companies and other technology platforms to develop that ultimately do what Charlie is doing, which is to help augment and strengthen mental health as opposed to detract from it? So these are some of the pieces that we laid out. I'll lastly just say this, these advisories that come out from the Surgeon General's office, these are not common. I'll tell you that in my time as Surgeon General during the Obama administration, I didn't issue any Surgeon General advisories. I issued several reports on the opioid crisis, on e-cigarettes in youth and other issues. But these advisories are reserved for issues that are of such critical importance to the country and such urgency that they can't wait a year or two for a whole report to be put together. They require the country to be called to attention now and to be called to action now. And that's why we issued this Surgeon General's Advisory on Youth Mental Health. And it's why we're going to continue to be in this work, for months and years to come, working with organizations like Crisis Text Line and others who are incredibly important partners, because we can only get through these challenges if we work together as one country, as a unified society.
Thank you, Dr. Murthy. And what's so key to that is the fact that we can all play a role, right? What this advisory is saying is pay attention, nation, our children are in crisis, and do whatever you can personally, whether you're an individual, a company, a business, a system, to facilitate some change and some help. Unfortunately, our data is actually showing the same thing. Our texters texting in crisis under the age of 17, they make up 50% of all of our texters. So 50% of all of the texters in crisis are under the age of 17. And when do they text in? They text in at night, right? When they're lonely, when it's quiet, when everyone is asleep, that is when they are in the deepest amount of pain. Some of the top reasons that they're seeking support, as you can imagine, include anxiety, depression, and relationships. For our youth in the audience today, if you're here, what we're seeing in our data is likely playing out in your life. If you're in middle school or high school, you're possibly seeing your friends struggle with these mental health challenges, or maybe you are struggling with them as well. And it can be sadness, it can be anger. Mental health challenges present in so many ways. It's just you're not feeling right. I have two teenagers, one in high school and one in college, and we really try to be very mindful about discussing mental health. There's so much trauma in the lives of our teens right now. It's really no surprise that they're struggling. Charlie, can you talk about how this resonates for you and your experience as you've created this app, this very important and very relevant app?
Yeah, that 100% resonates with me, especially with my experiences with making the app and why we actually made the app. We created the app because we didn't see anything like it in the field that could actually help. I actually made it for my sister Hannah, who came up with the idea after developing a chronic illness called POTS, postural orthostatic tachycardia syndrome. Basically just causes her to faint when she stands up. The blood vessels don't actually contract, so she just passes out. And that quickly made her spiral into deep depression and anxiety and self-harm, and led to her eventually attempting suicide. Thankfully, my mom did stop her before it actually got to the point of actually committing. But during that moment, all she wanted was to be able to press a button and be able to get help and be able to just have her support group around her. So I think that being able to witness and be a part of the creation of an actual solution during that time just really puts all this in perspective, especially with the teen suicide rate being incredibly high, the second most common cause of death among teenagers and young kids behind accidental death. It's just something that just puts it all into perspective when you just think about it, because it's just an insane problem that most people don't actually address until now.
So to say that you are the ultimate sibling is an understatement, Charlie, right? You have cared not just for your sister, but for every teen out there who might be in need of exactly what she asked for, a button to press to get help in the moment. So it's always inspiring for us as adults to meet young people like you. It fills us with hope. It fills us with energy. To both of you, Charlie and Dr. Murthy, thank you for sharing this. The work you do is so important to making sure that young people can reach out to somebody they trust in their lives. And it speaks to this acute crisis that young people are experiencing. So let's talk a little bit about what people can do if they or someone they know is experiencing a mental health crisis. I'll lead with a couple of coping strategies that we share here at Crisis Text Line. Oftentimes, one of the things a youth or anyone can do is talk with someone trusted in their lives, ask for help, know that you are not alone. Reaching out for help is so important and so critical. Loneliness is one of those deep, dark feelings that drive people to suicide because they feel like there's no one that cares, or there's no one around, or there's no one that can help. So if people feel like that, they can reach out to friends, they can reach out to family, they have Charlie's app, or they can reach out to Crisis Text Line. For us, we don't gatekeep on crises. If someone defines something as a crisis that they can't cope and they can't function, our volunteers are always here 24/7 to help. It can be anxiety, depression, loneliness, eating disorders. It can be as simple as frustration over homework, all the way up until feelings of suicide. We're also here for whatever difficult emotions, unnamed, unidentified, but difficult emotions, when people just need someone to talk to. Again, all they have to do is text empathy to 741-741, and you will be connected with a volunteer crisis counselor. What are some other things that people can do? Practice self-care. And self-care is important to talk about because it's the individual attention to what you need. It's the things that make your life better. That's very specific to you as an individual. So some examples: fresh air, exercise, good sleep, healthy foods. But really it's about feeding your mind, body, and spirit in a way that speaks to you, that calms and soothes and balances you as an individual. Another strategy is to really set healthy boundaries. We know that the news inundates us with negative stories, right? And that's what kind of sits in our psyche and sits in our minds, especially our children, where social media makes videos and the repetition of national crises so accessible, and it just buries right inside the brain and sits there and naturally affects mood. So we have to protect ourselves. We have to have boundaries and parameters and time frames during which we'll check these news cycles. It can't be continuous. And lastly, when it's accessible, because we know we have a mental health professional shortage in this country, right? But when professional help is accessible to you, reach out to that person. That can be a licensed psychologist, a licensed social worker, a psychiatrist. All of these folks are trained professionally to support in this work. It is not always something that a teen or an adult can do on their own. Charlie, can you give us some examples of things that you recommend young people do to take care of themselves, or even some examples of what you do for self-care?
Yeah, no, 100%. One of the things that I actually have to do every now and then is just delete all of my social medias, because social media itself isn't a negative or a positive thing. social media is a magnifier. And if you keep on liking the posts of things that like, if you keep on liking like fitness things, you're like, oh, I hate my body after that, it's just going to keep on magnifying the feeling of not liking your body and just distaste towards your whole like body and everything. Another thing is just self-care. Self-care can mean so many different things for so many different people. Self-care for me is drinking water, getting my laptop, watching Netflix, and taking like a 6 hour long bath and just isolating myself in that bathroom and just like hiding away from all my problems for 6 hours. It works so well. Another coping strategy that I personally use for my panic attacks is I just pop an ice cube in my mouth. And how that works is it hydrates you because when I'm having a panic attack, I usually forgot to drink water or just something else is happening. It shocks your system and it just lets you do something with your mouth. And also just engaging in hobbies. Like I bake, I skateboard, and I program. And it just honestly helps get your mind off of whatever's happening and let you do something with your body.
Thank you, Charlie. So I have to say, I have not tried the 6 hour bath yet. Lots of hot water, right?
Yeah.
Lots of hot water. But what's key here and what we're hearing from Charlie is that he has identified the very specific things that work for him, right? So a 6 hour bath is something that calms him, helps him to center himself. That may not work for somebody else, but the point is to really try out different activities, different stimuli, to give yourself the opportunity to find that thing that calms you down and make a list, right? Just have your repertoire of self-soothing and calming activities or things that you can reach for when you feel like you're anxious, because anxiety strikes all of us. This is not something that's specific to youth. It's not something that's specific to any demographic. Everybody can feel anxious or depressed or sad or lonely at any point. There's enough going on around us to justify that feeling and to say, like, it's okay to not feel okay, right? It's okay to say, like, today is not a good day for me, and these are the things that I need to do to take care of myself. So Dr. Murthy, what are the top 1 to 2 coping strategies that you would recommend based on your research and your office's research on youth mental health that we can suggest to these young folks?
Well, it's a really good question and a very practical one. And I think, as somebody who myself has struggled with my own mental health during my childhood and times during adulthood as well. And I say that just because I want people to know that this is normal. It's like part of being human is like experiencing difficulties with your mental health from time to time. So it's something you tell people who call in crisis, but sometimes we all need to hear that again. But I find that there are two things that are important to consider. One is in those moments when you're feeling poorly, when you're feeling like you're in crisis yourself. Question is, how do you turn up the volume on the things that help you, that give you peace, inspiration, and remind you of your self-worth? And how do you turn down the volume on the things that make you feel poorly? If you think about that latter, the second category for a minute, sometimes, all of us have people in our life who, despite their best intentions, might make us feel more poorly. Or sometimes our use of social media can make us focus on the things that remind us of how we're not enough, that we're not good looking enough, we're not popular enough, we're not at the parties that everyone else is at, etc. So tuning those out is really important when you're in crisis to not exacerbate, how poorly you're feeling. And then the second question is like, how do we boost ourselves up? And some of the points that Charlie and you mentioned, Dr. Turner, I think are spot on. Talking to people, reaching out, which is not easy to do when you're in crisis, but that's why I find actually that having a group of friends or 1 or 2 people, whether it's your parents, your siblings, good friends or other family, who you say, hey, look, if I'm in a tough spot, I'm going to call you. Is that okay? Just making sure that they know that they're a resource for you. That's important. I got 2 people outside of my family who are good friends of mine, and the 3 of us made an agreement, a pact actually, that we would form something called the Moai, which is an old Okinawan tradition where people come together from an early age and they kind of commit to each other, to helping out one another, to being there for one another. We decided to do this a few years ago. So now whenever we're having a tough time, or we'll reach out to each other, we made a pact that we're going to do that. And then the other people will answer. In fact, later today at 3 o'clock, I'm talking to my two friends in MOI. It's just part of what we do. The last thing I'll share, though, is something that may not be intuitive, but actually two last things, if you'll indulge me. This may not be intuitive, but it turns out that serving other people is actually a powerful way to lift our own spirits. And the reason that's not intuitive is sometimes when we're struggling, we think, gosh, we need somebody to help us, right? Where's the help coming? But it turns out in an interesting way, and there's some interesting science behind this too, that in those moments of crisis, if we reach out, help somebody else, try to be supportive of somebody else who might be in crisis, it does two interesting things for us. One is it actually forms a connection between us and that other person, even if they're a stranger, even if we're volunteering to help somebody or helping a classmate, somebody we don't know that well. It forms a connection, and that's important because in our moments of crisis, we can get further and further into this cocoon of loneliness, which is really destructive and painful. Now, but the other thing that it does when we serve others is it reminds us that we have value to bring to the world. And that's one of the toughest things about our mental health struggles is in those moments, we both feel alone and we feel worthless, right? We feel like, gosh, like people wouldn't even care if we disappear. People we're not really bringing any value to the people around us. We're not adding anything to the world. We're just not good enough. And serving others reminds us that we do bring something valuable to the world, that we are not alone. So those are a couple of things I keep in my back pocket. Service is a source of sustenance, if you will, cutting out those negative influences in that moment, whether it's people or social media, and then looking for people that we can reach out to, a good friend, family member. But setting those expectations ahead of time can be really helpful because it's hard sometimes when you're in a crisis to suddenly like start to have a conversation about somebody about the fact that you hope they can be there for you, when you're having a tough time.
Thank you, Dr. Murthy. So many gems that you spoke of. I think why we're here today, right? Martin Luther King Day, day of service, serving others to help not just others, but to help ourselves. The acknowledgement that we all can go through mental health challenges at any point, that it's not something to stigmatize anyone over because it can happen. And it's, some would say a natural response to all of the chaos and crisis around us is for our mind to kind of shut down and protect, right? And withdraw and separate. But what I'm hearing you say that's so important is step outside of that and connect with someone else, and you'll actually start to, it's like a ricochet back to yourself. When you all registered, we got a slew of wonderful questions, and we'll have probably five or 6 minutes to address one or two of them. One of them that we thought was important that I wanted to ask Dr. Murthy and Charlie to speak upon is for people who say that all of these problems are so big and overwhelming, how can they as individuals be a part of the solution? And what solutions can they bring to their community? Charlie, do you want to start, please?
So one of my favorite things to tell people when they ask this question is, if you have an idea, you just have to go for it. If you have an idea for a solution like how I did, you have to go for it no matter what anyone else is telling you, because if you don't do it, no one else will. And also you can work with amazing organizations. If you don't want to like make your own thing, you can volunteer for amazing organizations like the Crisis Text Line. Love you guys. Manami, Mental Health America. There are so many amazing organizations out there that you can make an actual change in the world with. So yeah.
Thank you. And Dr. Murthy, was there anything more that you wanted to share on this?
I totally agree with Charlie. I think volunteering for an organization is such a powerful thing you can do. They're great ones, or Crisis Text Line, Charlie's organization are just a couple. And it's, again, that form of service can actually help lift you up too. The other thing that I would just remind people of is like, as incredibly like overwhelming as these problems can seem, and they are large, they are big, there are a lot of people who are affected, but often the most effective strategies start at a grassroots level, but the decisions we make in our life about how we treat and reach out to people around us. Just remember, every person that you reach out to and check on in your family or your friend circle, is one ripple that you've created, right? You can't always tell from the outside if someone's doing well. People put on a happy face all the time, but they're really struggling inside. But when you pause for a moment and you just check on a friend and say, hey, I'm not calling for any reason. I just want to see how you're doing, or if you're actually worried about a friend, and say, hey, I'm worried about you. Are you doing okay? How can I be there for you? How can I support you? When you share your own story about your own struggles, all of these things give people the permission to feel okay about their struggles and then to ask for help. And when you do that for one person in your life, and not only does it help them, it makes them more likely to go on and do it for other people. So just know that even if you didn't set foot, in another organization, even if you didn't build your own, effort the way Charlie has been so brave to do, even if you didn't become an advocate and try to get better mental health, legislation in place so more people have access to care, even if you weren't involved in any of that, you can have a powerful impact on the health and well-being of people around you simply by stepping up to check on them, to be there for them, to help serve those around you.
You sound like you have taken our volunteer training, Dr. Murthy, because that is exactly what we train our volunteer crisis counselors in, how to incorporate into a regular conversation that kind of check-in, right? Where you don't have to be a therapist, you don't have to be a licensed anything to say to someone, I know you, I care about you, something is not right, I'm here for you, right? And it's that outreach that so many people I've heard who've been on the brink of suicide have said, if someone had just reached out or noticed, right, that I was not myself and said something, right? And I think people get paralyzed or frightened that they have to have all the answers, when really you can just sit with another individual, share Charlie's app, share crisis text line, just check in and have that frank and honest conversation and point them to resources and sit with them and help them find those resources. It can be as simple as that. For those of you who are on now and feel inspired to get involved, you too can sign up to be a crisis counselor at crisistextline.org/united, and you'll learn more about our training. And one of the wonderful things about our training and how we feel like it not just changes the community who texts in, but we feel like we're putting people out there in the world to change the world, to bring empathy to the world, because the tools and the skills that people learn through our training help them in all sorts of different domains. Their personal relationships. We've had teachers talk about how it's helped them work with their students. Parents talk about how the training has been helpful with their teenagers. But it's about active listening. It's about support. It's about identifying those coping strategies. So again, thank you both, because this is just so key and important to both our audience here and what we do and try to offer at Crisis Text Line. With that, I think I'm going to jump to our key takeaways. So what we want from this time together, and thank you, Dr. Murthy and Charlie, is for our audience and folks out there to take away that you can be a part of this solution in any crisis, large or small. You can, like Dr. Murthy said, connect and spread empathy to your community by checking in on people that you care about, having those conversations, telling people that you're there for them. Again, the resources that are available that we mentioned, that Charlie mentioned, Dr. Murthy mentioned, getting the word out in your community. You can access some of our toolkits at crisistextline.org/united. Bring posters to your schools. We have a mental health toolkit for schools. Every little small thing that an individual can do can make a change for so many. That ripple effect you talked about, Dr. Murthy. And again, we're open to having anyone apply if you're over the age of 18 to volunteer and serve that way from the comfort of your own home. You will be able to touch thousands of lives. So everyone, we are at the point where we're about to close out, but I want to thank you all for attending today and showing up for youth mental health. Our children need us. Thank you, Dr. Vivek Murthy, Charlie Lucas, AmeriCorps, for your continued commitment to this important topic. We're going to make headway. We have to. Our children depend on us. In the words of Dr. King, I'd like to just say one of my favorite quotes is, "Not everyone can be famous, but everyone can be great. And because greatness is determined by service, you only need a heart full of grace and a soul generated by love." Any last words from you all, Charlie or Dr. Murthy, before we close out?
Charlie, go ahead.
My last words are just, if you know someone that's struggling, one of your friends is struggling with mental illness or just mental health problems in general, just be there for them as much as physically possible, because you're their support group. You're their closest trusted contacts. And honestly, but if it gets too out of hand, don't ever be scared to refer to like crisis text line or like a trusted adult if you're a minor. But just be there for people, and remember, it's okay to be not okay.
Thank you.
Beautifully put, Charlie. And I would just say, just to remember that you are all healers in your own way. You don't have to have medical degrees or nursing degrees or be counselors, but you all have the power to heal because you can help people feel seen and to know that they matter. Those are two of the most powerful things that we all need in our lives, but which so many people do not have. And lastly, I would just say, please take care of yourself in this process as well. Your well-being matters. Your mental health and physical health matters. And so making sure that you're sleeping enough, making sure that you are exercising and eating well, making sure that you're cultivating and taking care of your own relationships, and then making sure that you have people in your life around you, who you can enjoy time with. That's an incredibly important part of being healthy and well, of sustaining yourself, so that you can not only be happy, but you can continue to serve others, hopefully for many months and years to come.
Charlie, Dr. Murthy, thank you. Thank you for these words of wisdom and your expertise and your willingness to come together with us on this MLK National Day of Service. Thank you to everyone who has joined us. Either in need of service, please reach out, or if you have a heart for service, please join us as a volunteer. Thank you and have a wonderful day.